The actions. So what's going on? What's happening in Canada? Okay, this part here where we're finding solutions. Well, there's a National Aboriginal Diabetes Association that has been created in Winnipeg, which is more of, I think, a clearinghouse for information and for people to find resources to work together. Their mission is to address diabetes amongst Aboriginal peoples, creating networks and opportunities for individuals, family, and community within their beliefs, values, and traditions. Okay, so this is the one, a national organization that then puts its name out to get people working on diabetes projects, whether it's care and treatment, prevention, education, so that we can beg and borrow from one another and be clued into resources. In another world, in another time, here's the little story about NADA. Actually started by the Sugar Group, is a group of Aboriginal women in Winnipeg that were concerned about the rising rates of diabetes among the people in that urban community back in the mid-'80s. They started this organization. So again, grassroots people making the change. And we have to remember that in the urban setting that it often becomes then a pan-Indian way of doing things, mixing of cultures and ceremonies and ways. There's not one nation that of Indigenous people that lives within Winnipeg. They come from many places. Okay, and they have another conference next month actually in Winnipeg. All right, there we go. Okay, the idea of NADA, okay, to support individuals, families, and communities to access resources, to create partnerships, promote community wellness as a strategy to prevent diabetes, and manage and operate effective and efficient ways. There's the Aboriginal Diabetes Initiative, which is a program funded under Health Canada, which ends in March 2012. It's for primarily First Nations, on reserve, and Inuit in communities because of the government's way of addressing and how they work with the different Aboriginal groups. You don't see Métis people under this part here. It comes under a separate component. Again, divide and conquer the people. But here we're looking at care and treatment, prevention and promotion, lifestyle supports. And then there's the Métis and off-reserve Aboriginal and Urban Inuit Prevention Program. And they actually have an acronym that they can pronounce from this one here. The important thing being that the government of Canada has recognized the problem and has been putting support into initiatives that are there for people to be able to tap into. And having been one of the people and groups that taps into that, it's been very helpful. It's a small step, but it's not the answer to everything. And even if I was to say, well, it'd be nice if they doubled the amount of money that they gave, you know what, deep down inside, it's not going to change a whole heck of a lot. That's my opinion about that. Okay, 3 phases, 58 million, then 190 million, and then there's a 2-year extension to 2012. Here, we want to reduce type 2 diabetes in Aboriginal people through a range of health promotion, prevention, screening, and treatment services delivered by an increased number of trained health service providers and diabetes prevention workers. And actually, in the last 2 years, they've trained over 300 Aboriginal people working in diabetes. They're called community diabetes prevention workers, and they've been trained through largely through a diabetes prevention program offered by Yellow Quills College out of Winnipeg, and also through a program in Portage College, which is in north of Edmonton. Okay. What they're looking for from the Aboriginal Diabetes Initiative, okay, jump to the final here, contribute to the improved health status of Aboriginal individuals, families, and communities through strengthened chronic disease and injury prevention program and support. These are the intermediary steps. We want to increase awareness, get people involved, get people working together. We want to maintain healthy behaviors and have communities owning the efforts, owning the works, and improving access to quality, well-coordinated programs. So this is what's in existence, and we're hoping that for 2012, they're going to announce a continuation about that. The Aboriginal Diabetes Initiative accomplishments in primary prevention, lots of diabetes prevention activities, education, hands-on, cooking classes, walking clubs, etc., things like that. Building capacity, as I said, there's been over 300 community diabetes prevention workers that are going on. You have mobile screening clinics, telehealth, and screening for retinopathy and foot care taking place in more communities now. And in research and surveillance, there's been some community scans. The Circle Project, which I said came out of University of Western Ontario with Stuart Harris, and different reports. There still has not been that huge nationwide study, longitudinal study on things again. And certainly these things are lots of darts thrown at a dartboard, and they land in all different places. Okay, it's certainly there's not that consistency across the board just yet. This is about the renewal that's going on for that project. Okay, and again, the main themes: primary prevention, getting to the children, teaching children first about healthy lifestyles, screening and care, building capacity, supporting health literacy, supporting community-based planning, evaluation, and data collection, and support for Aboriginal-specific research. And this down here, the research, is a very contentious issue. I'm going to talk about that in the next session. So what we're about then is wanting to get back to the relationships with people. The idea behind wellness is putting it into the quiz for everybody here. This is your exam. Solve all the components of the equation to get your doctor's license. Okay, there's the answer for you. Okay, wellness is daily physical activity plus healthy eating over a daily positive attitude. Voila, it's that simple. Everybody go home now and do it. And of course, therein lies the complication, the complexity in doing each one of these things. And medical, you know, you fit right in with all of these things, but I mean, that's the basic. And Danielle, I told them they could get copies of the presentation through you after this. Okay, lots of information that's out there. Like I said, Yellow Quills College. SODI is down in this neck of the woods. We're doing a 2-day thing out in Niagara Falls with a group of youth the next couple of days. Northern Diabetes Health Network is in Ontario. Our project in Kahnawake. You have the Inuit Urban Diabetes Awareness and Prevention Program, and the National Aboriginal organizations in NAHO are doing some work around diabetes, and also the Canadian Diabetes Association doing some work. So our responsibility is for the future generations, okay, our little ones, that's my grandson, okay, and the young people, that's my granddaughters, and the adults, that's me, and the elders, that's my dad. Okay, so I brought some of the family with us here. So thank you for your attention on that one. My apologies for getting stalled on that one particular area around the problem, but I think it's important that we understand that world and what's happened, because that impacts, in knowing that, that impacts on what you're able to bring as doctors to your patients, is that there's that sensitivity that has to be around that. And I showed you some of the statistics, rushed through those. That's certainly not my strong point, and some of the activities that have gone on.